battle over mask mandates once again playing out in local communities. We showed you that celebration in St. Louis County last night after the city council there voted to rescind a mask mandate in indoor public settings that had just been put back into place on Monday. But the St. Louis County executive insists today that that mandate still stands. And for more on this, we're joined now by Dr. Faisal Khan, the director of the St. Louis County Department of Public Health. Thanks so much for being here, Doctor.
Thank you. It's a pleasure, Lindsay.
So first, just clarify for us, is an indoor mask mandate still in effect for St. Louis County, Missouri?
So, that's a very good question, and that was my greatest fear based on what the council chose to do last night, that it would create utter confusion in the minds of individuals and businesses as to whether a mask mandate was in force. As things stand now, the legal status, the precise legal status of the mask mandate will be determined by legal recourse, I'm sure, at some point in the future. Our public health message, based on that mask mandate, still stands. We stand by the recommendations that we made in that mandate, which was to encourage people, regardless of vaccination status, to remain masked while in indoor settings.
So I guess the question then is it enforceable at this point?
Regrettably, no. And the reason for that is very simple. The enforcement mechanism would have followed once the mandate was rolled out. Regrettably, the council's actions have made that almost impossible to follow through on. At this point in time, we are entirely dependent on the responsible corporate behavior of individual businesses and business settings and proprietors and owners and senior management to ensure that their staff and customers remain masked while they're indoors. But we have no mechanism to actually enforce it.
You told the council that the data backs up the case for a renewed mask mandate due to rising hospitalizations and more younger COVID-19 patients. What are you seeing right now as far as the impact of the Delta variant in your particular area?
Community transmission in the St. Louis region, as indeed throughout Missouri, is at an all-time high. We are very worried about what the late summer, early fall season will bring for us. School goes back in session in a couple of weeks. And so we're working with school districts to ensure that kids and staff remain masked while indoors and to encourage vaccination for 12 plus. But the fact is that the St. Louis region is now dealing with the same sort of situation that we saw play out in southwest Missouri in Springfield, which made the headlines a couple of weeks ago. And so our message, what we're taking great pains to explain to people is you cannot run away from this. You cannot will away the virus. It does not discriminate between politicians of one creed versus another. It will cause more misery, more infection, and more death. There is no doubt about that.
Have you seen any uptick in vaccination rates at all as the cases and hospitalizations have risen in recent weeks, or are the hesitant still holding out on taking the vaccine?
Unfortunately, progress has been very slow, and that is for a variety of reasons. Vaccine hesitancy, doubts about the efficacy of the vaccine, mistrust of government, et cetera, and on and on. However, the fear that escalated as a result of what was happening in southwest Missouri did create a little bit of a bump. However, 55% of the people in the St. Louis region are still not vaccinated, and that is a ripe population segment for the Delta variant of the coronavirus to cause misery and disease.
What do you say to those critics, though, who say that bringing back mask mandates, even for the vaccinated, really undermines confidence that the vaccines actually work if vaccinated people still have to wear a mask?
First of all, the virus determines the future course of action. Public health and the scientific community base our recommendations on the best available evidence. What we know today to be effective against the coronavirus is not the same as what we knew in November last year, and is not the same as what we knew to be true in March this year. So our response evolves and is modified according to the situation that presents itself in front of us. The Delta variant was not around two and a half months ago. It is now the predominant variant across the United States. And so we have to be nimble in our response.
And we've seen the debate over masks politicized, of course, and opponents saying that wearing one should be an individual choice. We saw one NFL player who came out today describing himself as pro-choice when it comes to vaccines. As a public health official, how do you respond to that personal choice or freedom argument?
I am certainly respectful of differing opinions. There's no doubt about that. However, the greater good and the collective good is more important than individual nuances of liberty and freedom at this point in time. As a nation of individualists, we are seeing the results of that play out across the country. More death and misery has been caused by attitudes at this point in time than anything else. That is really sad and should cause all of us to reflect on what we're doing. The vaccines available today are safe and effective. People need to listen to public health messages, get the vaccine, and continue to wear masks, because that is the situation we're confronted with. And by the way, this is not the only variant around. There will be more in the future, because that's what viruses do. They find susceptible hosts and communities, they thrive, they mutate, and they regenerate anew.
And lastly, Doctor, if I can just kind of get a personal sense, I think I'm detecting a little bit of frustration in your voice when you're just trying to follow the science and other people are really pushing back on that so much, and it puts other people's lives at stake. How are you feeling about all this?
Look, as a public health professional, I really don't care what someone's political affiliations are, whether they're Democrat or Republican or Libertarian or what have you. This virus will not discriminate. This virus will not stop at state or city or county boundaries. It never has, and it never will in the 18 months that we've been fighting it. So please get over yourselves, do the responsible, common sense thing, get a shot, get over your ignorance. Don't listen to the nonsense being peddled on social media and WhatsApp. And please do not listen to politicians who try to mislead you by scoring cheap political points and indulge in populist opinion and fear-mongering over this. The science and the evidence behind this is very clear. This is a clear and present danger to the health and safety of people in the United States, including the St. Louis region. We are running out of time. We do not want any more people to die of the coronavirus than already have. 660,000 at last count.
Dr. Faisal Khan from the St. Louis County Department of Public Health, we thank you so much for joining us. Appreciate your time.
Thank you so much, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.